What if supporting adolescent girls' health began before there was a crisis? On this Women on Wisdom episode, I'm speaking with Dr. Rabia Khan. She is a lead physician at East Wellington Family Health Team, and we're going to be talking about taking a prevention-first approach to health and well-being of young women. Together, we're going to be exploring the growing pressure that girls are facing today, everything from social media, screen time, body image, to sleep, nutrition, anxiety, self-esteem, and mental health. Dr. Khan explains why adolescence is such a critical window for building healthy habits, strengthening support systems, and creating positive change. She also shares how parents, educators, healthcare providers, communities can ask better questions, set healthy boundaries, and help girls feel truly heard and supported. This was such a meaningful conversation about prevention, advocacy, and the small, meaningful actions that can make a lasting difference. Welcome to the show, Dr. Rabia Khan. I have been really looking forward to speaking about female adolescent health, and I have a ton of questions for you. So welcome, Rabia, and I think that my first question, of course, is, I'd love to know your journey to family medicine.
Right. And thank you, Sandra. I've also been looking forward to this. So back in the 90s, here I am, a really eager, super excited medical student, going through my rotations and trying to figure out what's next. Like, what am I going to specialize in? And nothing's quite gelling. Like, I'm going from rotation to rotation and nothing's clicking for me until I do my family medicine rotation. And I did it in a small town in Northern Ontario, and just fell in love with family medicine. I mean, we would start our days in the hospital to do rounds on patients who had been admitted overnight, and then we would have our clinic jam-packed full of patients, and no 2 days were ever alike. You just never know what's going to come through the door. And I saw the whole gamut, chronic disease, all the way, like from the cradle to the grave, so to speak. Preventative medicine, we did procedures, we did home visits, and then we would end our day in Emerge, doing our shift, as often family doctors do in small towns. So that was my journey to family medicine, and I just really fell in love with not only family medicine, but also the core piece of preventative medicine. Because as you know, now, today in my clinic, I do memory care. So that's kind of the other spectrum. And in that, we talk about aging well and dying well. And so that preventative piece and the steps that can be taken early are still there. They're still the core of what I do.
And it's, when you say and you talk about preventative, I mean, from cradle to grave, it really is important in managing our health throughout our whole life. So, and I think that more and more doctors have to take this approach, in the future, especially. I just know that during COVID and in the last few years has put a lot of stress on the health, in our country. The first question, though, that I wanted to ask you, and it's kind of a two-folded question, it's really why shifting to a prevention-first approach in adolescent female health is so urgent. And then the second part of that is talking about what does the research say about long-term gains when we intervene early.
Okay, and those two questions really are intertwined. I'm going to share with you. So there's a report called the World Happiness Report, and it comes out annually, and it sort of monitors, if you will, the happiness index, and it categorizes it by age. And so we'll focus on teens right now, but it's no surprise that over the last decade, this World Health Report has been seeing a decline in happiness in teens as we see an increase in screen time. Now, you may say, so what we've seen, especially post-pandemic, is the average age for teens on screens would have been, let's say, 2 hours a day. And that's literally quadrupled to 8+ hours a day. And again, what I was saying earlier is that you might say, okay, some of that is research, studying, online, group chats, that kind of thing. But we know that a lot of it is actually social media. And the thing is, there have been thousands of studies now done over the period of a decade that show statistically significant differences in groups of teens who are on social media, 8+ hours, and who are not. And I'll just give you an example. So if you chart hours of screen use along the x-axis and symptoms, and I'm talking about negative symptoms such as depression, anxiety, low self-esteem, that kind of thing, the curve for boys is sort of linear. But for girls, it's exponential. The curve, it just goes like that. Yeah, and again, this is no surprise. Like the studies have been showing this over and over and over again. Um, I'm just going to touch on tip of the iceberg. For instance, symptoms of, again, anxiety, depression, low self-esteem is on the rise for sure in teens, but specifically teens who are on their screens. And the thing is that social media companies have exploited this. They have clued into this and they have exploited this. And I'll talk about this a little bit later. It takes a mere 35 minutes to get addicted to something like TikTok or Instagram for teens. I mean, that's how their brain is working. Cyberbullying. We're not talking about cyberbullying, but 1 in 4 teens are reporting being cyberbullied. When these teens are on their screens at night, it's affecting their quality and quantity of sleep. And so, of course, that's having a ripple effect during the day. And so now we're seeing an explosion of energy drinks and literally addictions to energy drinks. So, like, all of these things are there right in front of us. The key factor, you asked about the urgency. So we know that the teen adolescent brain is such a sensitive time. Like it's the time when the brain is making those connections, those social bonds, those emotional bonds. But here's the thing. There's a term called neuroplasticity.
Yes.
And what that means is that the brain is capable of wiring and rewiring and learning and relearning. And so there's the urgency. There's an author by the name of Jonathan Haidt, Haidt, who's written a book on the anxious generation. And he dives into all of this, the research behind this, the urgency behind why we need to be talking about this now.
Yeah, can you tell me those statistics that you quoted right at the beginning are the difference between boys and girls? What is the core reason for that?
Yeah, that's a great question. And it has to do with how girls versus boys see themselves. And, again, the social media companies and the advertisers have both sort of clued into this. And the way they make their apps more visually appealing is the key here. Girls are more in tune to their body image, how they present themselves, that kind of thing. Yeah.
And and that's a huge gap, right? It's a huge gap. But when if a young woman or a young adolescent comes to your office, what are you saying or what are you doing? What is preventative, a preventative approach? Before I go on to the next question, just so our listeners understand that.
So it's a matter of asking the question, to be honest. It is a matter of putting it back to them as to what matters most to you. Here I can give you my advice, but it's going to be up to you to pick what works for you, what you're going to be able to hang on to and work on consistently. So it's a matter of that sort of shared decision making, if you
Yes.
will.
And so, in the specific areas, which specific areas are affected most? You're thinking about mental health, sleep, nutrition. We've talked a little bit about screen time, but what offer the biggest opportunities for prevention and how should doctors really prioritize them? We have such a short window of time that we get to sit with our doctor.
Yeah, and again, so when I have the patient in front of me, I will say to them, I can give you my expert advice, but it's going to be up to you to pick what make sense? What's the low-hanging fruit for you? It could be any of those, any one of those, and each one of those is so important. Nutrition, diet, health, lifestyle, social time, and screen times. I feel like we have done a disservice to our teens by not asking them the question. So the way we did back in the 80s and 90s about smoking, I mean, look at, you ask a teen today, they're not going to get me going anywhere close to a cigarette, because we did our job then. But we're not doing the same when it comes to screen time or drugs and alcohol. 1 in 6 teens are now reporting having used cannabis in high school. 1 in 4 who drink alcohol are reporting binge drinking.
In high school.
Vaping is the equivalent in high school. Yes, and these are statistics that I've pulled out. Vaping is the equivalent of 40 cigarettes in terms of its nicotine content. So we need to shift from just a reactive approach, which is, medication treatment, that what have you, to a proactive approach. And there's where the asking the question comes in. But also there's something called social prescribing. And that's sort of a new thing. And I love how, what it means is that we can also prescribe, treatments in terms of nature and music therapy and art therapy, and just going out there. Sometimes when I have teens in my clinic and they're coming to me with symptoms of anxiety, depression, I'll ask them, "Have you considered volunteering?" I mean, just imagine that boost in self-worth that a teen would get when they just go out and volunteer a few hours. And again, it just comes down to the clinician asking the question. And you asked me, how do we prioritize that? Thanks to our EMRs, our electronic medical records, I have the button in front of me. I see when it's red, it means I haven't asked the question. And so I go ahead and pop the question, and it's a mere few seconds of asking the question and planting that seed in their brains. So
I love that. So it's triggering the question, and then you can go deeper into asking other questions that you might get to the root cause. So I feel like the medical system has really let women down, and research shows, how we turn up, in regards to our heart health, perimenopause, menopause. Are we talking to young women about their periods and how they're feeling and what's happening to them? Are we starting to even, think about how their cycle is impacting them physically, mentally, emotionally?
we are, Sandra, but it's still very early days. I mean, yes, there is the research that is linking PMDD, perimenstrual depression, if you will, and other symptoms that we used to sort of brush aside and say, okay, these are your hormonal changes that are causing these symptoms, which is true, but that's not to say that we can't address those and, address them preventatively with diet and exercise and better lifestyle choices.
I hope you're really enjoying this episode of Women on Wisdom. We are sponsored by TalentWise Collective. And my question for you today is, what's your organization doing to drive the equitable change we desperately need? TalentWise Collective supports organizations to empower their employees with services and programs such as coaching and transformative workshops, and my interactive talk, Bridging the Gap, which is designed for immediate and impactful action. Reach out to Connect TWC at talentwisecollective.com. That's Connect TWC at talentwisecollective.com. Let's build a truly equitable future together. It's really fascinating, and I hope the journey starts to continue. I think more doctors are taking women's health and looking at it differently. So although you're not focusing as much on that, I'm still hopeful for the future that we'll take from adolescent all the way through to postmenopausal, the female health into account. I'd like to sort of step back into the social media thing because the trends are not getting any better. and the impact is huge. I've also been reading statistics, not just addiction and social media, but also gambling is on the rise for young women online. So,
Mhm.
you know, for you, what are you seeing social media, how it's shaping adolescent girls, their physical, emotional, psychological, social health? So let's talk a little bit more about that. I think it's so important.
Yeah, and that's huge. You're right, Sandra. I mean, we know that girls struggle with their body image to begin with, right? Like a whopping 50% of girls will report being feeling dissatisfied with their body image compared to 30% of boys. And this is well before, social media. But again, the social media companies have exploited this piece in making those apps visually appealing to girls, because so there is this sense amongst girls, there is this sense of the feeling of missing out, or this compulsive problematic behavior of always being camera ready, that self-objectification, right? And so there's the social media companies, but then there's the advertisers as well. In 2022 alone, they amassed $11 billion in revenue just based on those female eyeballs under 16.
This is under
And so they work
16.
their algorithms, as you know, under 16, yes. The way they work their algorithms with the likes and the comments and the shares. So, we know that eating disorders are on the rise, and particularly in girls. Girls are more likely to engage in risky behaviors, unsafe sex, substance use. Hospital admissions that we see for girls with things like self-harm or suicidal ideations is 3 times more than boys. Um, Here's something that was really shocking to me. I was at a school board meeting recently, and they had the chief of police and the special investigations unit there, and they were talking about human trafficking and how that's affecting our teens. And so the national risk incident, if you will, is 1%. In other words, 1% of teens are being targeted across Canada. In Ontario, that number jumps to between 2 and 5%. Here in Wellington, Sandra, that number skyrockets, I should say, to 10%. 1 in 10 of our teens are being targeted. And what is their way into their lives? It's through social media. And again, those social media companies are well aware of this.
I, I, I can't even tell you how shocked I am. I know there was something in Guelph that happened recently with human trafficking, and sometimes you see it and you say, "Well, not in my neighborhood, not in my small town," and
Yeah.
and then you look at the impact is through social media. What and parents are doing their best. I know that most people I know with young children are trying to monitor, but it's how do you get control? Like how do you get control? What questions are you asking young women?
Yeah, and you're right. It's about asking the question. It's about showing curiosity and engaging and giving them the opportunity to open up. I don't know if I told you, Sandra, but there was a time when I was going to the schools, because we're not seeing these teens coming to the clinics, right? Like we see them when they're younger for their vaccines and what have you, and then we don't see them till quite a bit later unless they're coming in for a specific reason. And so we're missing that cohort. Where we can intervene early. And so I actually started going into the schools talking to teens just about, what does healthy anxiety versus problematic anxiety look like, and who to ask, who to reach out to. And even that would just set the
So,
stage.
when you look at the bigger picture of all of these things that are happening and that we're seeing, and the changes, and how social media is impacting our health physically, mentally, emotionally, what system level changes in the schools? I think you going into the schools, I think is amazing. Clinics or at a government level based on policy are needed now to support this widespread, what should be widespread prevention, early prevention, and how doctors and advocates can advocate for those changes today, because we need to do more. And I know in Europe, they're starting to do a heck of a lot
Yep.
more. They're starting to hold a lot of accountability, but there's also the physical side of it. What needs to change?
Yeah, and you know what? After sitting at school boards and hospital committees, I'd like to be able to say that the Ministry of Health and the Ministry of Education will put the patient or the student first and center of their decision-making process. But that would be naive. I mean, it really does behoove us as parents, as teachers, as educators, as clinicians to step up and use our voices and use our experience to influence. Um, the example of, and to prioritize teen health, like you said. Australia did it, right, back in 2025 when they banned the age of accessibility to social media for under 16, and they've been successful. And I understand dozens of countries have followed suit. Here in Canada, we have a Bill C-34 that's in the House of Commons right now. And so they're not just talking about delaying access, but they're talking about putting up guardrails and safety. So the Digital Safety Act is something that they're looking at right now. And so there's a website called Unplugged Canada, I think it's called. Anybody could log in and go on and give their 2 cents and their sign
Okay,
on to that
maybe what
petition.
we could do is we can put up a
Another
link to
example.
that in so Unplugged
Sure.
Canada. We'll look it up and put the because I think it's really important. We have
Correct.
to have our 2 cents. We actually have to start having our 10 cents
Yeah. Yeah.
say now at this point.
Yeah. Absolutely. Yeah. And another example is Sweden. So back in 2010, they went all digital in their school system. So they replaced every book with a device. But they very quickly started to see academic scores plummeting. And so they have reversed course. Yeah, and I remember back when my kids were in school, public health had mandated across all school boards something called DPA, daily physical activity. And this was outside of recess. So there was a mandated 20 minutes, all kids were going to go out for daily physical activity. I don't know if it's still implemented or not, but I thought it was a great idea. The Children's Foundation, this is an organization that oversees what kind of snacks are entering the schools. And they're very rigorous in terms of, checking ingredients. The fewer the better, obviously, as we know. I remember having conversations with parents at parent-teacher committees about what less is more. Just go with your local and your fresh rather than your packaged and preserved. These early habits have a lasting effect. I was recently talking to a member of a grand school board, and I was sharing all of this with her, and she was saying, you know what, we can do all we can at school, but sometimes, unfortunately, this gets undone at home by the parents. I had a teacher yesterday in my clinic, and she was talking about how so many teachers are retiring early because they are just so done. Like they just don't know how to move forward with this dilemma.
Well, you talk about
Yeah.
processed food, and I think this is really important. I spent a month in Portugal for a month in February, and all of their processed food had an A, B, C, D, E, F put onto it. So you knew, and every label, canned foods, frozen foods, and it was so it made you think, do I really want to buy something that's at an F and it has all these I tell you, it was such a great reminder, and it really made us think before we put certain foods in our basket. And some of the canned foods that we thought like beans, lima beans, all that was okay. The salt, we'd never actually thought about it
Yes.
that much. And now coming back here, my husband has become a label reader, and he's got an app that will also tell us. But yeah, so something like that would be amazing.
And yeah, like, do you really want to be feeding your kids something that's labeled F?
No,
Think about it.
I certainly didn't want to be. I didn't want. You should have seen in the cookie section and the sweet section. You just like, okay, let's just avoid that right now. And also, one of the things I noticed, we were also in the UK and we were in Ireland, and they talked about what was in the chocolate. how Cadbury makes its chocolate in the UK versus somewhere else because of the stringent rules in different countries. So I think this awareness, this labeling, this even the calorie counts, these are small things, but you mentioned smoking. What we did for smoking in the 90s, we can do this right now if we have a voice and we start demanding from corporations that they have to do better and hold more responsibility for the health of our children and the health of even seniors. I think that's, the other side of what we're talking about today. Any other thoughts about that?
100%. Yeah. No, I couldn't agree more. We have our voices and we can make that change.
So
100%.
in your last question, and one that I always like to ask, what your wisdom do you offer, both parents and to adolescent girls about navigating the system and making sure that they're being heard?
Yeah, that's a great question. So for parents, I would say it's not too late. Be involved, be engaged, observe where your children are spending, or your teens are spending time. Are they in their rooms, on their devices? And most importantly, be the model, right? Be the role model. Don't reward them with screen time. Have device-free zones, the dinner table, the bedrooms. In my house, we have a rule, there's no cell phones at the dinner table, and that goes for guests as well. Digital detox days. We can all do that. We can go back to our old-fashioned board games. We can go out in nature. And as I mentioned earlier, like do art together, music together. You know what? Send them off for errands. Teens love to feel the responsibility. So there's lots of ways that parents can step in. And for girls, I would say, so this is Gen Z that we're talking about. They are well aware of the experiment that they have been part of and the results of this horrifying experiment. And I would just remind them of that word,
Yes.
neuroplasticity, that their brains are forever learning and wiring and rewiring. So this is the time. It just reminds me back to my rotation in that Northern Ontario that I did early on. The very first patient that I met in hospital was a teen, and she was admitted for an asthma attack. I mean, can you imagine? We don't admit teens for asthma anymore because we're so much better at detecting and treating early. And so we can do that. We've learned, and we can do the things we need to do and let teens know that they matter, we matter. And back to creating those special, strong, emotional
I
and
love
social
that.
bonds.
I really do. And I love the idea of, I know my daughter is, she asks people when they come into her home to put their, if they're visiting, to put their device in a basket at the front, in the front hall. I think that's and she was, she
Great.
went, her and her husband actually worked in social media, and but they know the impact that it has on their lives and their health. First of all, I want to say a big thank you, and I also want to say thank you for the work that you do every single day, because I know that it's in this day and age, it's not easy. You're taking care more than just an individual's physical health. There's so much more to consider. The whole person comes to the table when they come to see you. So thank you so much for your insights. I'd love to get you on to even talk about elder care in the future, because I think I don't think there's a day goes by right now when I'm talking to my clients and talking to the people that we work with every day that somebody doesn't mention what's happening in their lives as far as managing parents, managing careers. And I know that you know this on a personal level, but I want to thank you very much for this insight. It's been fascinating.
Thank you, Sandra. Thank you for having me. I really appreciate it.
We are at a crucial juncture in history, and our equality is not a nice to have. It is now beyond negotiation. This is our future, our fight.
This episode of Women on Wisdom is sponsored by TalentWise Collective, a global talent development company that curates solutions for your organization's needs and culture. Please note that the opinions and comments of the guests or hosts may not align with TalentWise Collective. If you are interested in having Sandra speak at an event, or wish to reach out for any other inquiries, you can connect through our email at connecttwc@talentwisecollective.com. That is, connecttwc@talentwisecollective.com. Thank you.